Streaming 24/7.
24/7.
Bold Moves Radio.
Bold Moves Radio.
Afrika nakupenda sana. Oh, Afrika nakupenda sana.
Welcome to Bold Moves Radio. The show is Prudent Woman with myself. I am RHULANI BALOYI. I am your host, and thank you for joining us once more this wonderful and a beautiful Sunday. Thank you to all of you who are watching us via Facebook and YouTube. Thank you for joining us. You know, to be part of this conversation, all you need to do is send through your comments, your questions on the comments section. Those of you who are streaming via the Bold Moves Radio, you are welcome to be part of the conversation through WhatsApp. Send your WhatsApps to 081 358 8745. Let me repeat, the number is 081 358 8745. Thank you. Today is the first Sunday of the month of October. The second Sunday of the month of October. We are grateful, and I would like to say happy birthday to a wonderful and a special woman in my life. And I know in a number of your lives, prudent women who have joined us. Today is the 8th of October, and it's Pastor Joylene's birthday. We would like to say happy birthday to Pastor Joylene, the leader of the Abigail's Women Empowerment and the senior pastor of Mana Tabernacle. She is my spiritual mother. This is a woman who has encouraged me, a woman who has lived her life, and through following on her footsteps, I was able to see myself birthing this ministry, Prudent Women. So I would like to say to all of you, please wish Pastor Joylene a happy and a wonderful birthday. Yes, of course, as Prudent Woman, we bring forth different topics, different discussions, conversations every Sunday from 4 o'clock up until 5 o'clock here on Bold Moves Radio. The idea with Prudent Woman is to make sure that we become prudent in our ways as women. We say we want to be women who are intentional, who take decisions that are well informed, who make sure that they respond appropriately whenever any season comes in their lives, because they are women who have got information. Because the word of God says, my people are destroyed for lack of knowledge. And prudent women who have joined us, who have been part of this conversations, I believe you agree with me that we are never the same. We are prudent women indeed, and happy birthday, of course, to Pastor Joylene. And prudent women, we are here today being the 8th of October, and as a country, as a nation, South Africa, this is a month where we bring awareness in cancer awareness. This is a condition that has taken a whole lot of our loved ones. And we say thank you to medical science, because today we are able to discover cancer in earlier days. But again, it is based on one having information, knowing how to identify the symptoms before it is too late, so that the medical science can be able to help them. So today, once more, we bring to you our lovely doctor, Dr. Tiyiselani. Is not the first time she has been here. She is here to bring in awareness in terms of breast cancer. I invite all of you. We may have heard about breast cancer so many times, but what I love is that medical science and research continues, and you can never say you have heard enough. You need to continue to hear what are the current trends, what is currently happening, what is it that has been advanced in terms of diagnosis, in terms of treatment. So she is here. She has taken a time on a Sunday where she was supposed to be with family to come and help us to understand how do we identify breast cancer, what are the symptoms, what is the treatment that is currently out there. This is a woman who deals with people with this condition on a daily basis, because she is a medical doctor. Dr. Tiyiselani, thank you so much for being part of Prudent Woman, and would like to say the stage is yours. We are here as prudent women who would like to learn as much as you can. And of course, even though we've heard about breast cancer so many times, but we believe medical science is advancing as much as all other spheres of life are advancing. And would like you let me say, just take us through what is there currently when we talk breast cancer. But before we can dwell deep into the conversation, Dr. T, I would like you to greet the audience. And as you greet the audience, maybe some of them have not been part of this show when you were addressing us. So just tell us, what is it that you do on a daily basis?
Okay, thank you so much, RHULANI. My name is Tiyiselani. I am a medical doctor. I am based at the Polokwane Provincial Hospital, currently at Medical Oncology Department. I have been a medical officer since 2007, but since 2013, I've been treating people who have cancer. So I'm working in a department where we directly treat only cancer patients. And I thank you for the opportunity to share with the Prudent women today. Thank you.
Thank you so much, Dr. Tiyiselani. How privileged we are as Prudent women to have someone who says she, on a daily basis, work with people who are suffering the condition that we're going to be talking about. And of course, we always say, when it comes to medical conditions, they will not present themselves exactly as they've presented themselves with the other person, because as human beings, we are unique. We are totally unique. No individual is similar to the other one. But what we appreciate is that medical science, their research, whatever that they are able to discover and assist us with and come up with treatment, it's helping us as the human race. And it is us having the information that will be able to have information, know about the condition when it's still time, and be able to even have the courage. You'll agree with me, you are able to be courageous when you feel you know something. When you feel you do not have information about a particular subject, it's very difficult for you to even stand in faith to believe that you can beat this. That is why we are bringing this awareness this afternoon. Thank you so much. Dr. T, we're saying we're talking about breast cancer. Maybe we can start by understanding, when we say one has got breast cancer, what is it that we are talking about?
Okay, when we say one has breast cancer, we're talking about a type of cancer. I believe that most of us know the term called cancer. Breast cancer specifically, it's cancer that forms in the cells of the breast. So as human beings, we are made out of cells. So even our breasts, they are made out of cells. So the cells in the breast can outgrow, and they grow abnormally, and then they form what is called a tumor or a growth. So in that sense, that's where breast cancer comes from. So it's cancer in the cells of the breast.
Okay, so breast cancer, it's a cancer in the breast, in the cells of the breast.
Yes.
So
Yes.
anyone with a breast, it's susceptible to having breast cancer. I'm asking this question because I'm thinking someone may be sitting there and say, I do not have a breast, more especially our male counterparts. They just have your small nipples. Are they able to have breast cancer by them having the small breast?
Okay. Actually, even the males, they do have breast. It's just that it's not as big as females.
Okay.
Actually, it's more in women. Research says that 1 in 8 women, that's the risk factor for women, as much as the most risk factor for one to have breast cancer is being a woman. Before we go to anything else, by virtue of being a woman, you are at risk of having breast cancer. But because even the men, they also have breast tissue, they also might have cancer. It's just that with them, it's not, the percentage, it's not the same. With women, it's high, it's 1 in 8, but with men, it's can be 1 in 1,000. But even men, they have breast cancer. So most of the time when we speak breast cancer, it just feels like we relate more to the females. But yes, we do have males with breast cancer.
Thank you, Doctor. And as you were answering that question, you touched a little bit in terms of research. And in my opening, I spoke about research because someone may be sitting there and say, I've heard about breast cancer so many times. What can be different this time? But I would like to believe that with medical technology advancing, there are new things that are coming up in relation to breast cancer. Is there anything that you would like to share with us which is very recent, which we may not be aware of as it is at this point in time?
What I can say is, I can use this as an example that, when I was still at school, we learned about breast cancer, and breast cancer was something that we're told that it happens in women who are older. So we actually felt or thought cancer can only happen to you when you're old. But now, actually, when we speak of breast cancer, it's women of all ages. So that's something that's being found now. As long as you are a woman or you are considered to be a woman, you are at risk of having breast cancer. So I think that's the first thing. And the other thing is maybe now, previously, people had breast cancer that actually it wasn't diagnosed or they didn't know what it was because there was no knowledge about what was going on with them. But these days, with technology and everything, people now get to hear about these things, and when something happens to them, they get checked up, and that way it's how they will identify that actually whatever it is that I have on my breast, it's not something which is normal. It is actually cancer. So the technology and the medical science now is helping us more to actually identify and find these cancers, because I believe in the olden days, old people will probably die and no one would know that they actually had breast cancer. But now things are open and they are clear, and people are starting to actually go to doctors and say, check me, what could be going on with me, what is wrong with me, when they see changes in themselves. So those are the main changes, and those also even impact on how the treatment comes, because I think what led to delays in treatment was also the fact that if you don't know that something is going on with you, you will delay even consultation. But the earlier you consult, the earlier you get help. And that way you get help, and then you get something that will sort out or solve whatever issues that you're going through.
No, we so much appreciate medical doctors and researchers who continuously are investing their time and efforts into researching about all these different conditions that are out there. But of course, it's up to you and I to make sure that we educate ourselves, we go through research information that is out there so that you can be empowered. As she's saying, you can only be diagnosed if you know, if you are aware that maybe there's something about me, I need to be checked out. We can have all this technology, but if you are not available to make use of it, it may not be useful for you. I invited her to say that so that we can understand that this is, it seems like a common topic, but it's not that common, because medical science on a daily basis, they are finding out new things. You heard from her saying, we used to believe it's sicknesses for the old, which means even a young person has got a chance to have breast cancer. So you are able to have your eyes open and zoom in and say, maybe if there's some discomfort, you need to be able to say, maybe something is happening. Because as I was going through the preparations for this session, I realized, Dr. D, that, cancer has got different stages. And there are stages which are hopeful, and there are stages that will take a miracle for one to come out. And of course, you need to have known about it to be able to discover it at that earlier stage. I wish for us to go on an ad break. And when we come back, Dr. D, we're going to start talking now on breast cancer as a condition, looking through the symptoms that one may be presented with. Let us go on ad break. We'll be right back with you. You are listening to Bold Moves Radio. The show is Prudent Woman with myself. I am RHULANI BALOYI. I am your host. Today we bring to you breast cancer awareness, even as we bring awareness on different cancers during the month of October as a nation. And we have with us Dr. Tiyiselani. She's a medical doctor who is working on a daily basis with people suffering from conditions of the different cancers. Today, we are talking about breast cancer. Thank you for joining us from the different platforms. You can be part of the conversation by sending us your comments on the comment section if you are listening to us via Facebook and YouTube. If you are on the Bold Moves radio streaming, you can send through your questions, your comments on 081-358-8745. Before we went on an ad break, Dr. T took us through the different research outcomes that have been coming through as medical science and medical technology keeps on advancing. Dr. T, I wish for us now to zoom into breast cancer. What will be one of the first symptoms that may present themselves for people who are suffering from this condition?
Okay, the main symptom that most people who come and present with breast cancer, they usually present with a breast lump, or should I even say a breast mass, a mass in the breast. Like when you examine your breast, you feel there's a lump or there's a growth. So that's what we call a breast lump. But that's the main one, but that's not the only thing. There are other things that actually are very important for women. Like I said, it should be women of all ages. What women of all ages need to do, we encourage them to do what we call a breast self-examination, which they need to do on a month-to-month basis. The good thing about doing it on a month-to-month basis is you are able to compare that this is not how my breasts were looking like last month compared to how they look like this month. So that way you be able to pick up if there are any changes. It might not necessarily be a lump, it might just be change in the size of your breast, it may just be change in the skin of your breast, it can just be the change of the shape of your breast. So, or maybe a discharge from the nipple. So, but the main thing that we can say, it's a breast lump. That's what most women will come and say, I started with a breast lump. But the breast lump is not the only thing that women with breast cancer present with.
So, Dr. T, with those first symptoms, is it important for one to feel pain, or is there any pain associated with the first symptoms?
Normally, no. And I think that's why a lot of people, when they feel they have a lump, they tend to ignore. Hence, pain, by the time you feel pain, it means now even the disease has progressed or the cancer has progressed. So usually that's why I'm saying it's important to do breast self-examination on a month-to-month basis. How we encourage women to do breast self-examination is for women who are still seeing their period or who are still menstruating, they need to do it at least 7 days after their last normal menstrual period. Because during menstruation, the breast, they become tender. So you may think that it's a lump, but it was just tenderness from the hormones around the time of menstruation. So you wait until you finish with your menstruation, and then after that, you do it. But then as much as you'll be seeing your menstruation every month, it means now you can see that if there are changes which were not there last month after the menstruation, maybe this is something that may need to be checked. And for women who are postmenopausal, these are women who are no longer seeing their period, or maybe women who have removed their womb, so they don't have to see their womb. You can actually choose a day in a month where you just tell yourself, if you're deciding to say maybe your birth date is on the 8th of October, you say every month on the 8th, I'm doing a breast self-examination. I'm checking my breast. I'm checking to check, is there anything that I feel that I didn't feel last month? Is there any changes in the shape of my breast? Is there any changes in the size of my breast? Is there any changes in the skin of my breast? Are there any discharges on my breast?
That's very important, doctor. When you talk about during the menstrual cycle, that's very important because I've also realized that when you check your breast during that time, sometimes they're a little bit painful, uncomfortable, maybe because, as you say, they are full. And again, another important thing you mentioning, which I would like you to elaborate, it's the importance of doing it at a particular time in a month. Because it's easier for me to say, they said once in a month, and I do it this time, I do it on the 10th, the next month I do it on the 2nd, and all that. What will be the importance of making sure that you do regular intervals in terms of your checking?
The importance of doing it in regular intervals. Let's start with women who are still seeing their period. Like I'm saying, usually our periods, when you're seeing your periods, you know that I usually tend to see my period from the 4th to the 9th. So it means a week after that, then that swelling has subsided, or the swelling is not as how it was during the period. So that's the perfect time that for you can check your breast. So it's, and anyway, periods, they come month to month. So that's the perfect time for you to check your breast. And then for those who don't have periods, or who are not menstruating, or who are more postmenopausal, or maybe they've removed their womb, so they can't even tell whether it's that time of the month or not, it's better if you just have a specific day. At least if you know, I mean, every month has okay, I'm going to use today is the 8th. Every month has the 8th. There was the 8th of August, the 8th of July, the 8th of September, the 8th of October. There's going to be the 8th of November. So if I tell myself that every 8th of the month, I'm taking my breast, then that way it means whatever I see on the 8th of October, if it wasn't there on the 8th of last month, it could be something that needs further check-up, because it means it's a new thing which is developing in my breast. Because this is not something that I've seen before, or I've felt before, or I've actually gotten to know about. I'm actually discovering it only now this month.
Thank you so much, Dr. D. You see, we are getting to know new things, because previously when we taught about breast cancer, we didn't know of the importance of these different intervals. And I would like to believe it is because of the advancement of technology and research that is coming forth. But we can only get to know about this research when you go out and look for information. So let us not be ignorant. Let us be prudent women who always want to be informed, so that we can take informed decisions which will have positive outcome for our families and even ourselves. Dr. D, you know, when we talk cancer, one thing that most of us we know, it's their stages, which we are not even sure about. You know, you'll hear when someone says, I've got cancer, someone will be saying, what stage are you? You know, and we are made to understand that the stages they are very important in terms of cancer. Please take us through the different stages in terms of breast cancer. What does it mean? Why are we saying you must find out at this stage, not at this stage, so that we can actually, you know, I think if we get to be informed about that, it makes one not to be settled, to always want to have those intervals and stick to them, because we all want to live.
Okay. With most cancers, the stages of cancer, we usually have a stage 1 to stage 4. So it's the same even with breast cancer. We start with stage 1 to stage 4. And you can, like, you know, the number 1 to 4, it means it's increasing. So from stage 1, it's where you are at a point where even the cure rate or the possibility of you getting much more treatment, which is towards you getting cured, is higher, because it's because now actually the tumor which is on the breast, it's actually even less than 2 centimeters.
Okay.
Whatever growth is in the breast is usually less than 2 centimeters. And then between 2 and 3, it may just be above 2, maybe going to 5 centimeter. But then with the presence of what we call lymph nodes is something that we find in the axilla, in our axilla. So that is what stage 2 and 3 usually comprises of. The last stage, which is the more stage which actually there isn't much that is done that can actually save our lives or save lives. It's when a person is in stage 4, because irrespective of the size of the tumor, but if the cancer in the breast has already spread to other organs. So one thing about cancer of the breast, it loves to spread. Where I work, maybe it's because I work with people who use Sepedi language. They use moroho. Bari cancer is one moroho, moroho wanaba. So it may have a root where it started, but then you find the fruit somewhere there.
Okay.
So it's the same as breast cancer. It starts in the breast, but then via the lymph nodes, the drainage, then you find that it has spread. It can spread to the lungs, it can spread to the liver, it can spread to the bones, it can spread even to the brain. So that's what we call stage 4, and that's the most stage which actually most of the time there isn't much. It can just be buying you time with your loved ones. But at least if it's gotten earlier by stage 1, even the treatment is very effective. Hence, now we go back to what I was saying, that, you know, the breast health examination, if you do it and you don't wait, because it means even the one that gets to stage 4, it started from stage 1, it just grew. As much as I'm saying that number 1 to 4, you can't just start with cancer today and it's already stage 4. It means when it started, it was at stage 1. But then because you were not aware, you were not checking, it grew until it got to stage 4 where it has spread. And unfortunately now, when it's at stage 4, it's so difficult to treat it.
So today we get to understand the different stages in terms of cancer, in particular today about breast cancer. I love what the Prudent women are saying here on our platform. Most of them, Dr. D, they are acknowledging and appreciating the very important information that you are bringing forth, to say this is very important information. And they would like to say thank you so much for bringing in this awareness to the ladies. And of course, we learned today that breast cancer does not only affect women, but it also affects men. So let us go, prudent women. Let us get this information and be able to help even our loved ones, the male counterparts, because mostly at this point in time, even myself, before I went through the research to prepare for this show, I always believed that breast cancer is only for men, for women. I thought male do not have to worry about it, but we heard today that even male can suffer from breast cancer. And as she rightfully put it, to say, when we did not know, there were no diagnoses and a whole lot of things. Some of our loved ones, our parents, our forefathers have passed on, and we may be saying, no, it was not there before, but they may have passed on because we did not know about it. We were not able to get the right diagnosis to say they passed on because of breast cancer. But today we know, and we will look after ourselves, we'll examine ourselves to make sure that we are able to identify it at the right time, because she says when you discover it at an earlier stage, it is easier to heal it. And I think we all know what, even if you have shilonda, sisho outside, when it's still small, it's easier to heal it. Unlike when you leave it and you don't clean it, it gets rotten and all that, it's very difficult to heal it. Let us go on an ad break. When we come back, Dr. T will be talking to us in particular about mainly the treatment that one has to undergo, because I know, just like myself, most of us, one thing that we are fearful of is the treatment that one has to undergo in terms of cancer. So I would like her to take us through the different treatments that are available and what will she like to say to us to encourage us. We said awareness enlightens us in terms of information, but again, it helps us to be courageous, to be able to stand, because we know what is to come. We are not taken by surprise. Let us go on a net break. We'll be right back with you.
Are you ready for the ultimate dietary powerhouse? Look no further than Masana Dietitian's Nutro Boost. Our scientifically formulated low GI food is designed to give you the boost you need to fuel your body and reach your health goals. With Nutro Boost, you have the flexibility to enjoy it as a high fiber cereal or a satisfying shake. Simply mix it with water and indulge in the mouth-watering flavors that we have to offer. But that's not all. NutriBoost is packed with essential nutrients that are beneficial for your overall well-being. Enriched with 20 immune-boosting vitamins and minerals, it's a convenient and effective way to support your immune system. And here's the best part. NutriBoost is gluten-free, egg-free, and high in omega-3, making it suitable for those with dietary restrictions or allergies. Need an energy boost? NutriBoost has you covered. It's high in energy and protein, providing you with the fuel you need to power through your day. Whether it's a busy morning or an intense workout session, say goodbye to midday slumps and hello to sustained energy with NutriBoost. Try it today and experience the difference. For orders or to become a distributor, contact us on the following details.
You are listening to Bold Moves Radio. The show is Prudent Woman with myself. I am RHULANI BALOYI. I am your host. Today we bring breast cancer awareness to you through Dr. Tiyiselani. She is a medical doctor who works on a daily basis with people with conditions of similar conditions, as in different types of cancer. Dr. T, we're talking about breast cancer. And I see women are asking, is there different types of cancer, of breast cancer? I'm not sure if I'm clear for you.
Yes, yes.
Yeah, different types of cancer.
Yes, yes. There are different types of breast cancers. Hence, what happens is, okay, let me just use an example of the first sign where we spoke about the lump.
Yeah.
When you discover a lump, the first thing that I will encourage women to do after the breast self-examination and then you find a lump, it means you go for what we call a clinical examination. A clinical examination will be done by someone who's your GP, your surgeon, or your nurse. And then when they examine you, and then what follows after that, there are some investigations called, and it's either a breast ultrasound or a mammogram. And the other investigation is called a biopsy. A biopsy is when they take tissue of that lump which was found on the breast. So now, when we talk about the types of cancer, it doesn't mean that the type of breast cancer that this person has is the same as the type of cancer that the next person has.
Okay.
It may be, yes, all these two people, they have cancer, but now the pathologist who's gonna look at that tissue which was removed will even give the specifications that this one is this type of cancer. There are some cancers which are highly aggressive. There are some cancers which are not as aggressive. So it differs from one person to the other. There are many types of cancers. It's just that overall we call them cancer, but they are different. And hence even their treatment is different.
Very important information, Dr. D, because most of the time, as you say, we call them cancer. And the temptation is that when I am told you've got breast cancer, will be to look at the next person that I know who suffered from breast cancer and believe that I will go through similar treatment. And the same things that have happened to them will happen to me. So it's very important that we understand that cancer, it's cancer, but it may be different, even though it's breast cancer. And with that, are the symptoms of breast cancer similar, or anyone can present with any different type of symptoms?
When we talk about the symptoms are usually the same. They're usually the same. I think what differs, it's more, like I said, like with the symptoms, things to look out for when you do the breast self-examination, it's mainly those lumps, the changes in size, the changes in shape. Are there any nodes? Nodes is this growth which you can feel on your axilla. So they take it from there. So the symptoms are usually the same, or they are mostly the same. Some just present with a discharge from the breast.
Okay.
So those three things that I spoke about, which are important: clinical examination, an ultrasound and a mammogram, and a biopsy. They are the very three things which are important, which will determine which type of cancer you have. So the signs and the symptoms that all these people usually present with may usually be the same.
Okay.
May usually be the same, but then what the pathologist will say, it will be different. That's what will identify one cancer from another cancer, though both of them or all of them are called breast cancers.
Thank you so much, Dr. D. And I think this says to us, you may be going through the symptoms and knowing someone who has gone through the same thing, but your journey in the fight of this condition may not be the same. So we cannot make a total ruling and say it's going to be like this. It will be different because we're individuals, as we said. Thank you so much, Dr. D. And now, most of the time, most especially as people of color, will normally say, no, Mang passed on this, and because they are part of my family, I think I'm going to die from the same condition. Can we say the same thing with breast cancer? Can you inherit breast cancer?
Okay. Yes. Breast cancer, it's genetic. What happens is most women who in their families there's history of breast cancer, they are at a higher risk of getting breast cancer. But that doesn't mean that if you don't have any family history, you won't get breast cancer. When we started the talk, I mentioned that the main reason or the main cause or the main overall thing that exposes women or all women to cancer is virtue of being female.
Yes.
So it's not, you don't inherit being a woman. It's just that, yes, cancer, mainly breast cancer, it can run in the family. There are people who will say, my grandmother had it, my mother had it, and then, or maybe they don't even know. But yes, the cancer runs also, it's genetically, it runs in families. But and what we are tending to notice now, there are people who have no known family history, or maybe they were not even aware that actually this cancer is there in their families.
You know,
Yes.
I'll take advantage of you being here as a medical doctor, Dr. D. You know, when we go for consultations, time and again they'll ask you, is there history within your family for this type of condition? And that question tends to trouble me. I always answer it and say, no, as far as I know, because I've realized as Black people, let me say, we don't have information in terms of our health conditions within our generation. What will you like to say? We are prudent women in this program, and it's my desire that we should be able to start building up and doing things differently. What will be your advice in terms of keeping record for your family, medical record, let me say? What will you advise us, you know, and how important it is for one to know their medical records? I'll give an example. You know, I have one of my kids whom I was taking for a medical procedure, and the doctors asked me, does he have this allergy? And I didn't know the way they said it. I didn't know they have the allergy, but because I like saying, as far as I know, they do not. But I went on, by the grace of God, I went on and say a statement that made them want to poke me more. And when they asked, they poked more. I told them of an incident, and then they said he's allergic to that. The child is allergic to that, and the medical doctor said to me, God is good, because should you have not went further and say this, and we will have administered what we are about to administer, we will not have your child back. He was not going to come back because he's allergic to it. And it made me realize that it's very important for us to keep medical record. What will you advise us as a medical doctor?
I think now, honestly, we are in a very fortunate time, RHULANI, because, you know, I think the reason we don't really have the medical records of our great grandparents, what they went through, how their deliveries were, and all that, it's because there was no technology and all that. But we are at a time where technology is quite vast now. We find that, you know, we know a lot of things. There's information everywhere. So I think it's important as a family to know your family history. It's important to know who am I, and then even in church or in the Bible, they will tell you that things that you suffer, usually it's not starting with you, it's something that it's generational. So that way, those are the things that even medically, yes, there may not have been documented before, but we can start from now to start documenting, because I believe the people who are listening to me at the moment are people who can document, you know, because sometimes you find someone and the family would say someone was admitted in hospital, and this person, they just said he had something in the tummy and then he died. But then when you go, I think even for me, someone in the family, and then when I went to medical school, now I'm starting to learn these things, and then I can see that actually, no, that was this. But because then we all didn't know what it was, we just thought they just had something in the tummy, you know. So it's important to keep knowledge of everything, and technology is our best friend. let's keep our family history. Let's know what is running in our families. And even if it's not about family, because like I said, that, you know, with breast cancer specifically, yes, I can say it runs in family, but life has changed. There's a saying that we love saying, even in my workplace, because most of the things that we see now, it's not things that we were taught when we were in school. When we were in school, we were taught that patients will present the way books are written, how our lecturers, they taught us. But if I can tell you and be honest with you now, things that we are seeing in the clinic, it's things that you actually can say that actually patients are not books. The way they are presenting, it's different from how we were taught that this is how it's gonna present with. Hence, it needs one to open up, have an idea, and not leave anything to chance.
Yes, thank you, doctor. And I think, Prudent Woman, this says to us, as much as we keep on saying, I'm saving on those platforms where we share pictures. It's about time. Let us share, let us save this information, and let us shy away from losing our loved ones. And the first thing that we think of, it's something did not go right. You know, we find someone to blame. Yes, pain, grieving makes you have pain and want to find someone to blame. But I can just imagine if we can want someone to blame by going through their medical records and document it, keep it on record to know that, okay, my mommy, this is what happened. Because in that way, I think doctor is saying to us, you are able to know that the chance of you suffering from the same condition, such as breast cancer, it's high, because you got to know that your mommy passed on because of it. And it is through information that we can be able to beat some of these things. So let us document, let us continue and save our pictures. Yes, we want good memories, but let us also find a way from today as a Prudent Woman, have that record where you record all the different conditions within your family. And it's not to continue and say you're going to leave them high and use them to scare you, but it's for you to be informed so that you can take good decisions that will benefit you when the time comes. Let us go on an ad break, and when we come back in our last 15 minutes, doctor, we're going to be talking about the medication that one has to go through and the different things that they do for one in order to fight breast cancer. You are listening to Bold Moves Radio. The show is Prudent Woman with myself. I am RHULANI BALOYI. I am your host. Today we have Dr. Tiyiselani. She is a medical doctor. She's talking to us about breast cancer. Dr. T, I see Ceci Nkame Manganye asking, how common is breast cancer to men, before we can go through the treatment part of our conversation?
Okay, initially I did mention that breast cancer is more common in women. Research at the moment, it can say that 1 in 8 women, and okay, because we are Black women, I can actually say that breast cancer is the most common cancer in Black women, mainly even in South Africa. We do have cancer in males. With the males, the ratio may not be accurate, but we do have it. So it happens. I can say if with women it's 1 in 8. Maybe with males it can be 1 in 100.
Okay.
But it's common and it's there. It happens. So even males, they need to check their breast. Yes, their breasts are not as big as us,
Yes.
but you know, whatever is going on there, it's something that needs to be checked.
Okay. Thank you. I trust that Sesunkame Manganye is answered in terms of the ratio for male in terms of finding themselves with breast cancer. Dr. Tiyiselani, when a person now has been diagnosed to say they've got breast cancer, what should they expect in terms of treatment?
Treatment for breast cancer, it goes back to the stages. We spoke about the stages. Your stage will determine the type of treatment you're going to get. So now I will go back because today it's more about breast cancer awareness. When we bring the awareness, it's because I want to highlight the fact that women and men, and mainly women, because it's women of all ages, can we do breast self-examination? Women after the age of 40, please do yearly mammograms. If you have a family history of breast cancer, please check your breast. Don't forget, because you are at a higher risk also of developing breast cancer. So the treatment now, we speak of, we can either have surgery. Surgery, it means that tumor which is in the breast, when it's in the early stages, the surgeon can actually just remove that tumor.
Okay.
And then if there are lymph nodes, they will remove the tumor and the lymph nodes. That's what we call surgery. And the removal of the lymph nodes will be called lymph node dissection. And then as the stages grow, as they become more to your stage 3, that's when now actually we even get what we call chemotherapy. Chemotherapy, it just means a treatment which is used to kill cancer cells. So chemo is from the word chemical. So it's chemicals which are used to kill cancer cells. Like initially when we started the talk, I said that cancer, it's cells, it's breast cells which are developing abnormally. So chemotherapy work will be to try and kill those cancer cells from developing and outgrowing abnormally, because that's what ultimately will cause the cancer. So the chemotherapy is used for that. And then most of the time, chemo will be used mainly for the more advanced stages, because with the advanced stages, the cancer is actually spread more from the breast to the nodes, which is in the axilla, or even to the other parts of the body. So it's saying this chemotherapy will even try to even kill the cancer in the other parts of the body. If it has spread to the lungs, to the liver, to the bone, it's chemotherapy that will be used to treat cancer in all those places, that in those body parts or organs where the cancer is actually spread to. Yes. There's something also called radiotherapy. Radiotherapy is the same as doing an X-ray. It's using X-rays, but this one, it's specifically done usually after removing the breast. If you've removed the breast, they usually give radiotherapy to the area where they remove the breast, because sometimes they may cut and remove the tumor, but then they may leave some few cells. So radiotherapy now will come in and try to kill those small cells which are left, so that those small cells, they don't come back and grow again in future. Yes. There's a new treatment which we haven't really started. It's called immunotherapy. It's still being investigated, where they would actually want to say, you know, like with your flu, when you have flu, we say with your flu, your own immune system will fight. So even with cancer, they are trying very hard, the scientists, to find us treatment whereby your own immune system will fight this cancer in your body. So it's called immunotherapy. And then before I can close on this, on the chemotherapy, it's not only a chemotherapy that you get through a drip. Chemotherapy can be given via a pill or a drip. So it's in two forms. But the work of chemotherapy is to kill the cancer cells.
Wow. You know, as you explain it, doctor, you make it much simpler, you know, because most of the time we're fearful because we don't understand what has to go on. You find a person after the diagnosis, and once they say you can start with treatment, most of us wants to shy away from it because we have been made to believe, or what was there previously, as you are saying to us, now we have this, now you are busy with this, they are researching on this. And I would like to believe as they research on different methods, they are making it much more bearable. So as you explain them, we are able to see that medical science is moving and they are making things much more bearable for the patient. As you are now saying that they are trying to find a way of making sure that your immune system fights the battle for you than for you to get a foreign fighter in your system. And I like to believe the chemicals that they used to use on chemotherapy, which has made most people to be so fearful of taking cancer treatment because it was not bearable. The pain was too much. And I like to believe they're trying to ease the pain that we are talking about. We cannot thank you enough, Dr. T, for bringing in this information to us. And I see women here are appreciating you to say very powerful and very important information that you're giving Dr. Tiyiselani. They are so much appreciating. As we draw close to the end of our show, Dr. T, I know we spoke about it being genetic. We spoke about it being, me being a woman, it's a risk already for me. 1 in 8, that ratio is way too high for one, to say you can be presented with breast cancer. But I would like to believe maybe there are other lifestyle risks that we may increase the risk for us to develop breast cancer. What will be those lifestyle risks that we make us to be more susceptible to having breast cancer?
Okay. With this one, I can just say on addition to what I said, that the main reason will, that will still be my closing statement, that being female, it's the most risk factor. But hence, you can never go to a doctor or a medical professional who will not advise you to maintain a healthy diet, maintain a healthy weight, no smoking, no alcohol intake in excessiveness, maintain a healthy lifestyle. And also the fact that, as much as now, sometimes you may not be able to fight it, there are some things which are mentioned, which, research hasn't really proven. I know there are some people who believe that if you didn't breastfeed your child for a long time, you are more at risk of breast cancer. It's mentioned, but there are people who breastfeed their kids, but they still get breast cancer. Or maybe if you never had children, you will have more cancer as opposed to someone who never had children. So those are the people who, you find someone who had 9 kids, but they still have breast cancer. So lifestyle modification is very important. And also knowing that I'm a woman, and being a woman puts me at risk. And let me try and reduce and make sure that these other things which actually I can fight, let me fight them, so that at least even if there are other things which there isn't much that I can do about them, maybe the fact that it runs in my family, maybe the fact that I didn't breastfeed for whatever reason, it's there, but at least there are other things that I'm still able to fight and make sure that, I catch it very early. Because actually I think the message today is teaching women that, can we find it early? can we find it early so that we get treatment?
Thank you, Dr. Tiyiselani. We never have enough time as Prudent Woman because, an hour is not enough. And that's why we say we just spark conversations. So I would like to believe we've sparked the conversation on breast cancer. You will go out as a Prudent Woman and get more information. First, you will go out there and find out in terms of your medical records. If we do not have, yes, we cannot blame those who came before us. They did not have the ways and means to keep records, but let us start today. Instead of only saving the moments in pictures, let us save moments as well as in health condition, because they will be able to help you in the future when they ask you those questions as medical doctors, because those are the things that informs them. You have observed most of the conditions medically, they will ask you, is there a history in your family? Which has made me to realize that it means this is very important. Record keeping is very important when it comes to your medical health. So let us keep that information. Dr. Tiyiselani, this is the end of our show. I know we had a whole lot of other things, but we do not have time. The 1 hour, it's gone. I would like to invite you, as you bid our audience farewell, what would you like to say to us? Anything medically that is currently happening within our society that you want us to be aware of?
Okay, I think breast cancer is actually it's because it's quite big. I won't go into more other big topics. Let me stick to it. I think I'll just want women to know that early detection saves life. So I think my point of departure is women. Can we do our breast self-examination? Can we really, really, really go for mammograms when we are above the age of 40? Can we really check ourselves? And if there are any changes, please don't sit at your corner. Consult, go for clinical examination, and know your body. I'm one person who loves saying that you need to know your body, not only relating to breast cancer. Know your body relating to anything else that happens in your body. The type of urine that you pee, the type of stools that you go to the toilet and you see, the color, the skin changes, everything. Those are the things that you need to be taking. Know yourself. Know that this is me, but so that if there's a little bit of a change, you can tell and pick up and find treatment as soon as possible to whatever is going on with you.
Thank you very much, Dr. Tiyiselani. We have learned a lot in terms of breast cancer, and I think even in terms of medical conditions in general, because the information that you have given to us, it's, touches on a whole lot of other conditions that one may suffer from. As you say, you must get to know yourself. How many of us do we know ourselves? Do you know, I learned as well that our breasts are not the same size. I know your shoe size are not the same size. So those type of information, it's very important because it will inform you. You will not go into a shop and complain that, hey, my shoes, this one is not, and then now you want to go to the doctor, because you already know who you are. And if you indeed this cause for concern, you are able to take measure or steps that are required to be able to discover whatever condition before it goes out of hand and doctors are not able to help you to manage or treat it. Thank you very much, Dr. Tiyiselani. We had a wonderful time with you, and the ladies are saying thank you so much. You have empowered us. We now understand what breast cancer is in current trends that are currently happening, because medical science advances. And I would like to encourage everyone, whenever there is a topic, more especially in medical science, let us go out and get to know about it, because medical scientists are continuously researching. As we're sitting here, someone is in a lab trying to find out what can be done with this condition and that condition. And when you are not informed, you will rely on your decisions based on what was found in 1970, only to find that things have been changed now. There are ways of treating whatever condition that you are having without you being at the discomfort, like what we're saying with chemotherapy and a whole lot of other things. Thank you very much for all of you who have joined us, who have been part of Prudent Woman this afternoon. I would like to believe you have also learned. I have learned so much this afternoon. And thank you to the technical team. DJ Messi, thank you very much for bringing the show for us. And of course, our executive producer, Pastor Strike Mangani, thank you very much. I would like to invite all of you to be part of Bold Moves radio programs. Make sure that you have subscribed on our YouTube channel so that you do not miss anything. And of course, for now, we are on recess in terms of our morning devotions. We are not having our morning devotions at 6 o'clock on a week basis, but we will announce, we will have times where we will have morning devotions, and you are encouraged to continue with your devotions wherever you are, or you can join the Grace Bible Church. They have devotions every morning, Monday to Friday at 5 o'clock, and you are encouraged to join. Today, unfortunately, our favorite pastor is not here. The Living Word is not here, but tune in on Tuesday. We've got the African Experience. They will be there. You will hear of different people who have got experiences in the African continent. And I would like to believe you are enjoying yourselves. I'm enjoying myself every Tuesday. And for now, let us go and have a wonderful afternoon as you get ready to go to work. And we shall be with you next week, Sunday, 4 o'clock up until 5 o'clock. Have a blessed afternoon.
Ladies and gentlemen, here it is.
Streaming 24/7.
24/7.
Bold Moves Radio.
Bold Moves Radio.
Afrika, nakupenda sana. Oh, Afrika, nakupenda sana.